More than 40 people in California have died from the flu since September of 2018. In the last week, 2 deaths were reported here in the Bay Area, one in Santa Clara and another in San Francisco. And joining us now via Skype is KTVU medical expert Dr. Larry Burchett. Dr. Burchett, thanks for joining us today. I want to mention that this flu vaccine, or this flu rather, has killed 80,000 deaths in the U.S., last year's flu I'm referring to, and 900,000 hospitalizations. This is according to the federal CDC. Really bad. We haven't seen those numbers since 2009. How does this year's flu compare?
We don't know yet. You're right. Last year's flu was particularly bad. If you measure it in terms of how many people die last year, normally it's somewhere between 3,000, 30,000 is a bad year. 80,000 is off the charts. That was particularly lethal. This year, with the report of 2 people dying in the Bay Area, let's talk about those numbers a little bit. You follow people that die under the age of 65. Those over 65, it's much more common because they're elderly, they have more medical conditions. So these 2 that have died under 65, at this point in the flu season, that's not terribly alarming. I think the number last year was under 65, maybe there was 11 in the Bay Area that died. So these 2, and I looked it up, and the person in Santa Clara, there was a little asterisk by this case. The person was 35, and they had other medical conditions.
Yeah.
Because of privacy, we don't know the details of that. Maybe they had lung disease. Maybe they'd had pneumonia before. Maybe they had HIV or were immunocompromised and their immune system couldn't fight off the flu. So usually when these kind of deaths happen, there's some other reasons for it. It doesn't strike a normal, healthy person as frequently.
Yeah, and many people feel as though they can easily fight off the flu without seeing a doctor on their own. They say, oh, I just got to let it take its course. Is that a misconception, and should people just go and see a doctor if they feel those flu symptoms coming on?
I think that's probably true. Again, it's okay to stay at home and take care of yourself. Just take Tylenol, ibuprofen, get plenty of rest. Don't go out in public where you're contagious and you can spread the disease. I would say if you're a regular healthy person, if you're under 65, if you're not, if you're not a child below 5, and you don't have any medical conditions where you have a suppressed immune system or you have lung disease, things that would put you at risk for the deadly complications of the flu, like pneumonia, bacterial infection, respiratory failure, those kind of things, I think it is okay to stay at home for many people.
Can we talk about the flu strands and which one might be worse?
Yeah, so there's influenza A and B. There's some other subtypes that are just not as common. We don't follow them. But influenza A tends to be the one that causes these pandemics. And you remember the swine flu, H1N1. This year, so far, most of what we've isolated looks like H1N1, similar to the swine flu. So it has the potential to spread and to kind of cause a bigger pandemic. But whether that's going to happen or not, time will tell. Sometimes it can all be set up and then it just doesn't happen.
Hoping that this year's flu season is not nearly as bad as last year. Dr. Larry Burchett, always a pleasure to have you on.
Get your flu shots. You can still get your flu shots to help protect yourself.
All right. Thanks so much.